Good morning, doctors. I want to tell you today about something I've been thinking about for those of you who are treating children. For those of you who are in pediatric dentistry, whether you be a GP treating a lot of children or a pediatric dentist treating a lot of children, we have been trained to think that the primary teeth are absolutely gold in the mouth. We have been trained to think that we should be heroes in saving them. And I'm going to throw out a little bit of a wrinkle in the works. Not that they're not important. Primary teeth are very important in the development of the dentition, in the development of the bone structure, the alveolar bone, absolutely important. However, they are also sometimes problematic. It reminds me a little bit, to digress, of inflammation. You know, if you get a mosquito bite and you get a nice little swelling where the, quote, bite is, and it's inflammatory. It's an inflammatory process. And that's a good thing because it kind of walls off the toxin, the mosquito, whatever the mosquito has deposited there, whether it be microbes or mosquito stuff. I don't know what they put in you. Those areas are inflamed. Inflammation can be a good thing. However, if inflammation from such a bite happens to be too great, it can be a very bad thing, because it will actually wall off the circulation to the area. So, in other words, the body's processes and plans are good when they work just the way they were set out to be. However, in primary teeth, sometimes primary teeth become the problem and not the solution. For example, we often need to consider clearing the path for eruption. And that's something we talk a lot about in seminar. When do you do that? Again, protecting the value of the primary teeth in place, but at which point they become a problem or could be a solution if they're removed, or the removal could be a solution, then we need to think about doing just that. So one day I had sent a little girl off. She has a mama who's a dentist, and the mom's a general dentist, and I had told her that she needed to have a couple of primary Ds, which would be the primary first molar, removed because of the poor position of the succedaneous teeth. And also, I think that the lower canines might have been erupting. I don't remember. But the point is, she was supposed to have the lower primary Ds, first primary molars, removed. And she took her to her friend because she didn't want to treat her own child, which was fine. Took her to a friend, the general dentist, and told her, gave her my paper and told her that she would like those teeth to be removed. She came back about 3 days later. I saw her standing in the reception room, eyes wide. This is the mom, child in tow, and said, "Dr. Chris, she took out the wrong teeth." And she was beside herself. Absolutely beside herself, realizing that she had sent her child in and the child came out with the E's gone, the second primary molars, not the D's. I took a look. I said, well, let's take a look. The first thing, of course, to do is to calm the parent for whatever the reason. She happened to be a dentist, so she had different concerns than some other mother might have had. And we go in and we take a look. And I said, no problem. We're going to put a lingual arch in now to hold our what we call E-space. And of course, this mom knew what I was talking about because she was a dentist. And so I said, we're going to hold the E-space and we'll put the lingual arch in, which will be good anyway. And yes, the D's do need to be taken out. And so with the lingual arch in place, that protects her. And let's get it done. Let's fit the bands today, get it in tomorrow. Because I don't know if you know this, doctor, but within a few days, those 6-year molars will fold right into your E-space and take up a couple of millimeters of precious arch length on each side. You rarely have too much arch length. If you do, by the way, another side note, it's because the tongue is pushing, and the spacing in general is often because of too big of a tongue or too poor of a tongue position. So that's not usually the concern. So we got that lingual arch in, sent her back to have her D's taken out, and everything was well. And by the way, the eruptions went along nicely. This is about 1.5 years, 2 years ago, and everything's done well, and she's doing fine. So what am I saying here? Why are baby teeth not gold in the mouth? Because, doctor, sometimes they're blocking good eruption of a succedaneous permanent tooth. Sometimes they've had so much problem, they have had deep decay, let's say, and pulpal involvement. You take it out, make sure there's a space maintainer in place, again, to protect the space, and get rid of the problem. Why should that child have to come and sit in your chair, likely for several times, with a pulp that's really questionable, even though right now you've done the pulpectomy, maybe it seems good, but the reality is, why have that? So consider it carefully. We talk about this, and we talk about some of the parameters for when to leave teeth and hold on to them and do your best to save them, and when not to. So interesting thoughts for you today. I hope you'll give it some space in your busy day and think about this as you treat your kids. Dr. Chris, signing off.